Planet Vero Studio is powered by the Nolan Group of eXp Realty. MyNextHomeFinder.com.
Welcome to Treasure Coast Community Health. We have 8 locations to serve you better. Our staff is dedicated to help you and your family. Here's your host, Vicki Soulé.
And good afternoon, and welcome to Community Conversations. So glad that you dialed into this spot on your radio, and you will have an opportunity to hear an unusual conversation in that we have a brand new individual that I'm so proud has joined Treasure Coast Community Health. Everyone thinks that a federally qualified health center, because it's got federal in its name, must be wholly subsidized by the federal government, and nothing is further from the truth. The reality is that federally qualified health centers, although they are a part of the Bureau of Public Health, are independent nonprofits that must find their own way to succeed in terms of their financial longevity. So they do give us some funding. About 19% of our funding actually comes from the federal government. But, anytime that there's governmental grants, there's lots of strings attached. So we're not free to spend that money any which way that we'd like. And so we are, like all businesses, dependent on customer service, providing good quality care, having more people come in. And then, too, if you live in Indian River County, you know that we talk a lot about how philanthropic the community members are for so many of us nonprofits. And to this point, we have had some fundraisers. Certainly, we've talked a lot about our Duck Derby because that's a fun family event. And it is probably the main thing that we have done year after year. This year will be our 20th year of earning your fun and confidence and philanthropic dollars through that day's event down at Captain Hiram's. However, as we have grown and we see the need continues to grow in our community for good, preventative, and solid family health care, we know that we need more support than ever. And so delighted to have Elizabeth Thompson here today with me so that we can talk about what's on everyone's mind. How did Elizabeth go from the Boys and Girls Club to Treasure Coast Community Health? So there's my secret agenda right out in the open.
Well, I've been with Treasure Coast Community Health now. I'm entering my 4th week, so I'm truly a newbie.
Yes.
Still trying to find my way. But I was with the Boys and Girls Clubs for 12 years, and that was a wonderful, long run.
And you did wonderful things there in terms of expansions and making it more available for more children.
It was a wonderful 12 years. We added a gymnasium to the Vero site, and we also built a new building in Fellsmere, which allowed Boys and Girls Club to add more children in that community. So very well
Great
received
job.
there. Thank you. Well, I had a lot of help from the board of directors, so I can't take all the credit for myself. Certainly not. But I, of course, being in the nonprofit world here in Indian River County, I always knew about Treasure Coast Community Health. In my past life, before nonprofit, I was a registered nurse, and I have kept that license current. And so when COVID hit and the vaccine clinics rolled out, I think I saw you at a Rotary meeting, and I said, hey, can I dust off my license?
And I went, what? You're a nurse?
Yes, and help in that effort. And I tell you what, it was, it's been a year now since we did the vaccine clinics, and it was an incredibly rewarding experience, talking to our community, people with their concerns, and it just felt really good to be working in that capacity again. So now that COVID is hopefully behind us, I just got to thinking, hey, maybe this would be a good time to transition into something that brings in all of my experience and to such a great organization that really helps our community.
Well, we are thrilled that the connection stuck and we were able to figure out how we could go forward together to really do a lot of the wonderful work that is still ahead of us. We don't have a very large community as compared to someplace like Broward County down in Fort Lauderdale, or Orange or Osceola counties, with a lot of population. And so there's been some concern expressed to me at different times in my 12 years here that we have too many sites. But the reality is, for healthcare to be effective, it's got to be convenient. If you've got to go through 100 loops to get something done, you're going to easily give up and go on to something that's easier. That's just the way we're made. And certainly in today's environment, our patience is less and less and less for those things that take effort. So having the different centers around the neighborhoods are really an effort to ensure that people can get to their doctor, their dentist, their counselor, without a lot of stress and fuss. Even though we have a wonderful Go Line system, I appreciate it so much. All of our centers are located on the free Go Line bus system. However, if I watched a pregnant mom with a little toddler the other day trying to get on the bus, and she was probably 7 months, but with obviously child number 2, she was a little bit larger, and struggling to make that connection. I don't know where she was going, but it's clear that having things within walking distance really makes a difference. And so, as we see our population increase here in Indian River County and throughout Florida, because after all, if you're going to work from home, you might as well have flip-flops on instead of muckalucks, right?
Right.
So we anticipate that some of that growth is going to continue needing health care, and we're going to have to expand our services. So that means a different building or another building. And so with that in mind, your history of building and helping organizations expand is thrilling to us. Tell us about your love of philanthropy and the discussions. You've already had people in your offices talking to you.
Yes, very exciting. I do get excited about healthcare, especially equal access to everybody. I think that, when you talk about raising money, I think that children tug at the heartstrings of everybody. And I am amazed at the pediatric program that Treasure Coast Community Health has. We're talking about dental, vision, the vision program that's in Dodgertown Elementary School right now. We talk about the health of a community. Children cannot learn if they cannot see. And it's so basic, it's so fundamental that, who would not love a program like that?
But, honestly, I have to admit, we take it for granted that our children can see. Unlike a toothache where they, hold their cheek, or they get a little swelling, or they, they're off their feet a little bit. With vision, if it's always been what it is, the child's not going to raise their alarm bells to the parents.
Exactly.
And so we assume that things are fine, but maybe they're a little slow in reading. Maybe they're even dyslexic because you've gone through this 100 times and they just can't seem to pick up the pace or do the reading exercises, the spelling things that they need to do. And we're finding it's vision.
And I think that if you ask the majority of people, I know certainly it's true in my family, we all have experienced an uncle, an aunt, a cousin who finally got a diagnosis that their vision was not 20/20, and that really held them back. What outcomes could have been different if they had been?
Yeah, and my rebuttal to hearing that for the first time was, well, they screen in the schools. They screen in kindergarten, first grade, and third grade. But there's some literature out there now that says as many as 60% of the screens are false negatives, that kids do have these vision issues. So again, it's expensive to go to an optometrist or an ophthalmologist, and certainly parents don't have a lot of money to squander. So it's not really risen as a big issue until we started getting more involved with the Moonshot Action Committee network, where we're really working on peeling that onion back. If a child needs to learn to read by third grade, because after that it's essential that they read to learn, then how many steps backwards should we be taking to identify and remove those barriers to learning.
Yes.
Really the motion that we're on. We have in the past done vision screenings for adults as well as particularly diabetics. They have some retinal issues if their diabetes is not kept under control. And so we have supplemented that learning and education for our adults. And we find glaucomas and cataracts and all those other typical older age things. But again, as we are talking to individuals within the community, I've had people my age and younger say, you know, you won't believe it, but I had a first grader with cataracts. And I go, what? And I go, yeah. It's not common, but it's not that as rare as you might think. And other things that, again, we traditionally don't mentally assign to a child who's struggling.
Yes.
So very happy to be working on that. But again, we have a cadre of about 8 pediatricians. We're adding more because the reality is that particularly from birth on, there's so many changes to these little ones. And again, whether you're a new parent or an experienced parent, each one of our children are different. And so being able to have your pediatrician as an expert, as a sounding board. We used to rely on our moms and aunts, but there's nothing better than a pediatrician to tell you the whole picture from a scientific viewpoint.
Yes.
Although I guess that's maybe now a 4-letter word, scientific, because of the immunizations, but we won't even go there.
No, let's not.
Let's not. I think what we better do instead is take a minute for a word from our sponsors, and then we'll come back and we'll talk a little bit more. Thank you, Elizabeth. The new year is underway, and it's time to schedule your annual physical. This quick, comprehensive visit can uncover diabetes, high blood pressure, and even cancer, ultimately saving your life. Treasure Coast Community Health waives Medicare deductibles and offers a sliding fee scale discount, so everyone can afford to take care of their health. We can't fix what we don't know. Let's work together to make a healthier community. Call us today at 772-257-TCCH. We're a nonprofit.
They say a good contractor is hard to find until they find us. Hi, this is Greg, owner of Workhorse Residential Contractor. If you've got a job to do, call Workhorse. We can remodel your whole home, your bathroom, your kitchen, or even just put a fresh coat of paint on whatever you need. We'll give you a fair price, and we always show up on time. We're not handyman, we're licensed and insured contractors. We serve up to Sebastian and down to Fort Pierce. If you've got a job to do, call Workhorse. Find us on Facebook, Workhorse Residential Contractor.
Everyone wants to do their part in preventing the spread of the coronavirus, and doing your laundry the right way can help. This is Tom Rhodes, owner of Sunshine Laundries, with some helpful laundering tips. Think hot. Hotter is better because viruses hate heat. Wash your clothes in the warmest water setting allowed, and be sure to dry thoroughly in a hot dryer. For more helpful coronavirus fighting tips, visit sunshinelaundries.com.
It's time to call Easy Brew Coffee and Bottled Water Service and learn just how much you can save and how convenient it is to have your coffee and bottled water delivered right to your home or office. In addition to water coolers, Easy Brew offers individual bottles of water in 8 or 16-ounce bottles. No more lugging it home or dragging it into the office. Serving the Treasure Coast for over 2 decades, 2 letters, 1 simple name. Easy for Easy Brew. Visit e-zbrew.com or call 800-792-3285. Easy Brew.
And welcome back to Community Conversations. If you're just joining us, my name is Vicki Soule. I'm the CEO of Treasure Coast Community Health, which is a primary care provider here throughout the county. As our first intro said, we have 8 different clinical locations. 1 is for dental only. The other 7 are all integrated with medical, dental, behavioral health, pharmacy, X-ray. Not every service in every site, but as much as possible, we try to make it easy and convenient for you to receive the primary care services that you, your children, and even your parents might need. And we do that by accepting all insurances, except maybe some little podunk out in Minnesota that I have been challenged about. But by and large, we take Medicare, Medicaid. Our Medicare deductibles are waived for any services at our site, so that keeps about $180 some in your pocket all year. And we do everything we can to make it affordable through a sliding fee scale discount if you have an off year and are low income, as well as we provide payments for those that might have a high copay that's tough to bite at one gulp. So the main thing is come and see us so that we can help you while your problems are small before they get big, because most healthcare problems just don't disappear on their own, sadly. But today I'm happy to have with me Elizabeth Thompson, who has recently joined us as the Treasure Coast Community Health Foundation Director. So Elizabeth and I have been talking about our pediatrics and our growth and some of the things that are going on, and what a philanthropic community this has been, both in my experience as well as Elizabeth's as the 12-year executive director of the Boys and Girls Club. But she revealed a secret that some of you may have discovered last year when we were doing our COVID vaccine drive-thrus. Elizabeth's first, or prior life anyways, is as a registered nurse. So she's kind of coming back to her roots in terms of helping us explain to people about the value of healthcare. And so I'm not going to keep up my monologue. Elizabeth,
All right.
What would you like to say?
Well, the foundation has been a part of TCCH for since 2010. Does that sound right?
That sounds right.
So, it's an important arm of TCCH in terms of fundraising. We have a very philanthropic community, as you mentioned, and I see my primary job in the early stages of this part of my career is to increase awareness about TCCH with those donors in our community. I think they may know that it's here, but they may not know everything about it. And I had the opportunity 2 weeks ago to take a tour of all of the sites. And I have to tell you, I was really wowed by the quality of the facilities, the staff, how kind and compassionate they were with the patients. It was really an eye-opener for me. So I would, let the community know that it's not just for people who maybe make less money than the average Joe or 200% of poverty. It's a service that is available to everybody.
And it's funny that you say that, because as you're talking about not just for poor people, it made me flash back to my youth. And my dad was a tool and die maker. So every day he put on dress pants, a white shirt, and a tie and went off and did, very, very detailed drawings for the companies that made the parts that were in the Detroit assembly lines. So on the weekends, he would dress down. He would put on old pants. He'd dig in the garden. He'd putz in the garage. And my mom would say, Fred, you're home. I want to go to the store. We need to buy X, Y, and Z. Now, they were children of the Depression, so they didn't use any credit. My dad would willingly go with her, but he intended to go back to whatever he was doing, so he didn't take the time to change. And I watched the reactions that my dad would get based on the clothing that he had on. And I vowed that people would never, ever come into our centers and feel less than.
Yes.
Okay? Regardless of what they have on. Healthcare is a right for all people.
Absolutely.
Okay? And so I thank you for bringing that up, because that is a common misperception, that if we're a nonprofit and we're taking care of people who may not be used to caviar at dinner, that they should have a cheapening of the environment.
Most definitely. If you're new to Vero Beach and you don't have an established doctor here yet, come to TCCH. Try us out.
Yep, all of our people are board certified. They are experienced professionals that could get a job anywhere. They choose to work for us. We make their life a little bit easier in what we provide in wraparound administrative services, but more to the point, they like helping people.
Yes.
They don't want bureaucracy to get in their way, and they are top notch. We don't hire them unless they have experience and a lot of great credentials behind them. So again, it is for all, truly.
Absolutely.
Okay, I appreciate you saying that. Again, it's one of those misconceptions or myths that are out there. And I appreciate, with your new vision, seeing us with fresh eyes, for you to say that.
Yes.
So there's a couple of other things that I wanted to ask you. We only have a few more minutes. What do you see as your goals for, say, a year or two from now? What do you see yourself accomplishing?
Well, as I mentioned, definitely getting the word out about TCCH. We want it to be in one of the top 5 nonprofits in town. When you think of philanthropy in this county, I would love TCCH to be in the top 5.
I didn't know there was a list, but I'm sure you do. And I didn't prime her for this question, by the way.
Jay McNamara, who was a longtime board member for the Boys and Girls Club, always talked about, he was a marketing guy, and he always talked about the 5 top charities that you want to think of. So that's one goal. Down the road, maybe a planned giving program, but I think our needs are a little bit more immediate right now. Mm-hmm. If we plan on expanding, that will entail a capital campaign. Mm-hmm. So that's a shorter term program. And then just our annual giving program, making sure that we have a steady stream of donors to help with some of these vision programs, the dental programs where maybe certain things are not covered federally or otherwise, state otherwise, that we have the resources to make sure that we have everything we need to serve kids, women, behavioral health, all of the above.
Well, I like that. I truly do. I have to say that the community, particularly after our drive-thrus last year, have been very generous to us. But the cost of care is not just about, you pay those people so much. If we didn't, they'd leave.
Right.
Okay. I mean, everybody has a lower threshold of what they'll accept as wages, and our folks are not greedy. But it does have to balance in terms of money coming in and money going out, whether it's expenses for immunization material or ordering glasses that the patient can't cover the full cost of, those types of things.
Yes.
So I appreciate that. Are there any takeaways with our last minute left? Anything that you want to share with individuals?
Just what I mentioned earlier. Come to one of our locations. Come to the Duck Derby later on this year. Learn about us.
And they will see us out and about. We do have a new mobile unit that we were fortunate enough to get through the CARES Act so that we can reach more neighborhoods. And we've had a bit of staffing challenges like everyone around town. We're hoping in the fall that our volunteers will want to come back to work with us once the heat of summer is done. But you will see us out there for some pop-up events, as we call them.
The open house on May 7th.
Thank you. Duh. I'm telling everybody except the radio audience. Yes, we are changing things up at Gifford Health Center because our pediatrics provider, Dr. St. Hilaire, has been so busy that we are looking to bring in another part-time pediatrician to work with her. And so we're actually going to give her the space that was occupied by WeCare. That we'll have more announcements about WeCare and our affiliation with them coming soon. They have not completely dropped off the map. The wonderful physicians who donate their time through the community are still active with WeCare. We're just changing up the shape a little bit and forming a deeper collaboration. So if you have any time on, I believe it's May the 7th,
yes,
that's for Saturday from 10 to 12, come on by. You'll get a quick tour of the Gifford Health Center and meet all of our folks that are there. Yes. So thank you. Appreciate that. And we're just about wrapped up, so I want to again thank you all that are at the other end of the radio speaker here, and thank you for your constancy in dialing in every week to listen to us. We have a varied lineup. And you never know what to expect, but I've never heard anybody say, wow, I can't believe you had so-and-so, because we're non-political and we're not religious. So it's just all what's going on around our wonderful community. So thank you and have a wonderful evening.